So first, I'd like to thank the organizers and Bayshore for sponsoring this, and I finally get to talk about something that isn't pricing reform or pharmacare. Don't worry, there'll be opportunity for that later. I'll get on my soapbox at some point, but this is an incredibly important discussion. For those of you who aren't familiar with Novo Nordisk, we are the world's largest diabetes company. We make about half the world's supply of insulin and other innovative diabetes drugs, obesity drugs. We're also in growth hormone and hematology. A whole separate panel discussion would be why and how Novo Nordisk could have been a Canadian company, because of course it all started with the discovery of insulin in Toronto. Separate conversation, but one that I love to have with politicians. So why am I up here talking about diversity and inclusion? And I certainly don't profess to be an expert in the topic, but it is something that we have spent a lot of time within our management team at Novo Nordisk talking about. And the reason why we've been talking about it so much is because we do have a disproportionate mix of, and I've been introduced to a new term of SWAMs. Do you know this term? SWAM is straight, white, able-bodied male. Now, you could say to yourself that if we are a truly inclusive organization, a truly inclusive society, that it shouldn't matter what the composition of your management team looks like. And I can tell you for a fact that every single person on the Novo Nordisk Canada management team is 100% qualified for their job, has great experience, has diversity in experience. So in terms of the people that are there, there is no, you could say, underrepresentation. So then you could say, okay, but what's the issue? Well, as Sylvia presented, the statistics aren't getting better. And there is a flaw in logic by just saying that you always hire best qualified, because the assumption is that you're then picking from a suitably diverse pool of talent. One quick disclaimer, and I think it's important to understand the difference between diversity and inclusion. Diversity, of course, is an output. Diversity is counting. It's the mix. It's looking at numbers. Whereas inclusion is really about having an environment that really looks for and encourages a diverse composition. Similarly, when you look at terminologies like equity versus equality, equity is making things the same for everyone, whereas equality is making things fair for everyone. And that means, in some cases, leveling the playing field, making sure that everybody has kind of an equal starting point and everyone has the same opportunity. Which brings me to my case study, because when we start unpacking the reasons why we are not the most diverse management team, we realize that geographic mobility is actually a significant factor. Take my job as an example. As the president of Novo Nordisk Canada, it is very important to have global experience. And I kind of built my career by moving 5 times internationally in 13 years. And I'm better for that experience because of the network that I have within Novo Nordisk, the experience that I have living and working in different markets, the networking, and in an affiliate in Canada, having that strong network and tie back into your global organization is hugely important. If I go one step further and I look at my management team, the head of marketing, the head of market access and public affairs, the head of clinical, medical, and regulatory, the head of finance, are all individuals coming with global experience. So if global experience is said to be something that is important to be in a management team, then go hire people with global experience. The challenge is already you're picking from a biased pool of talent. When I was living in Copenhagen, and I go with my kids to the Copenhagen International School, you could see it very obviously there that you would see kind of all of the working expat dads, and then you would see the expat moms. And I still remember there was a guy named Stuart who was a working dad, and we actually felt bad for Stuart. It's like, you can join us, Stuart, in some of our activities, and his wife actually ran Carlsberg. And you start looking at it thinking, well, wait a minute, this isn't right, the fact that you have, for whatever societal reasons, more men that are able to have these global opportunities, and their counterpart, their female counterpart, is more willing to follow them than vice versa. And I think that we have the same issue within Canada. I mean, we have a very, very large geographic country, and one of the things that we look at when we're looking at succession planning, as soon as you get outside of the Greater Toronto Area, and as soon as you start looking at where Mississauga headquartered, as soon as you start talking about commuting into Toronto, you can quickly see that the people that are willing, ready, and able to put their hand up and say, I want to move to head office, is again disproportionately men. And I think that this is particularly an issue when there's a family unit and there's kids. And again, you can dissect the reasons. I'm sure there's psychologists that can write studies on it, on why maybe women, and I think Gamze talked about her guilt sometimes associated with being a working mother and being the anchor at home. But the reality is that this is a real barrier, whether it's that opportunity to first move into head office and gain that experience. It's an opportunity maybe to take a sales management job, but it requires you to move to the western part of Canada, or it's that opportunity to get global experience. We've become overtly aware of the fact that it will disproportionately favor men. So what's the solution? I think the understanding this issue and understanding this bias is the starting point. Number one, we also have to be careful about not making assumptions that women aren't mobile with young kids. I've heard comments in succession planning type meetings where they'll say, well, this individual is fantastic. She would be great for the position, but I know that she's got young kids and therefore probably can't move from wherever. Well, number one, we need to challenge that. We need to make sure that we're not making that assumption on someone's behalf. Number two, realizing that this mobility barrier is a real barrier, how can we bring head office experience to people that are living outside of the Greater Toronto Area? How can we bring global experience to people who are unable or unwilling to leave Canada? We have fantastic technology, although my caveat here is I don't know why it is that I can always use FaceTime with my kids, and our IT equipment that costs tens of thousands of dollars never seems to work, and I think case in point today with some of the AV challenges. But nonetheless, the technology is definitely there, and if we can be more flexible from a flex place standpoint and be more accommodating to allow individuals to be living in diverse locations, and they also have to show some flexibility on their side in terms of the hours that they work and willingness to travel in and out of the office, I'm convinced that we can have a more enriched and diverse pool of talent. Now, the other part of it is that there has to be the right mentality that goes along with it. And it's interesting because I've socialized this concept with a number of people, not just at Novo Nordisk, but also at other companies. There is a little bit of this, but I had to do it. I had to put up with these hardships, and I can tell you, moving 5 times in 13 years internationally is a pretty big hardship. It's really difficult on your family. I think it's even more difficult being a working mom and making these moves. And there is a little bit of this mentality of, well, I found a way to make it work, can't somebody else make it work? Well, isn't it even better if somebody doesn't have to make that extreme sacrifice, or quite frankly, is not able to make that sacrifice? And therefore, we're missing out on this great potential talent pool because of these mobility issues. So I started off by saying that I'm not a diversity and inclusion expert. I'm still not professing to be that expert, but I do believe that understanding the issue, kind of getting to the root, acknowledging that there is a challenge, and then trying to come up with pragmatic solutions in order to address it is the right first step. And I'd love to come back in another 2 or 3 years and tell you about how we've implemented this program at Novo Nordisk and how it has made a difference and how we are now a more diverse company from a management team perspective, where we have this richness of talent and a pool that we're choosing from that has similar experience, but we're able to gain that experience in a very different way. Thank you.